This is Learning Plan 8, Manage Care for Patients and Families Experiencing Violence. Chapter 28 is the first chapter we're looking at, Child, Older Adult, and Intimate Partner Violence. So the very first words in your book is there's no place like home. And it says it's a statement familiar to most of us because home should be a source of refuge and peace. But it isn't for many people. It's not a source of peace and safety and comfort as it should be. So of course that line, there's no place like home, is taken from The Wizard of Oz. And if you haven't seen that movie, you really ought to. It's a classic. But anyways, Dorothy is just desperately trying to get home. And she keeps saying there's no place like home. And that's the whole premise of the movie is her getting back home. So we tend to think of home as that place where all of our needs are met. It's safe, comfortable, our physical and our psychological needs. We can be ourselves. It's supposed to be just a really great place. But the book is recognizing that when we have issues like family violence, that home is not going to be necessarily always that place of peace and refuge. So this next cartoon really shows domestic violence and just how it permeates the entire house. And it is no longer home sweet home, as the picture on the mailbox or the sign on the mailbox says. That we can see the shutters are flying off of the windows, and there's a kind of bicycle and different toys, teddy bear and balls and things are kind of flying around, and it just permeates the entire house. There's no safe place in the house when there is domestic violence. Because it's a public health issue, nurses, of course, are very much in a good position to be very helpful to people that experience this issue. We'd like to call people, instead of saying victims, I'm going to try to say survivors instead, because that is truly the preferred word. A victim makes it seem like that person is just helpless. And if you call somebody a survivor, then that gives a little bit more strength to that person. And truly, if somebody is going through a situation of domestic violence, they definitely have a lot of strength to be able to come out of that situation. So I definitely want to encourage you to look at the video that I have posted on Terry Jandusa Nikolai. Some of you might be too young to remember when her situation happened, her situation of domestic violence, but she came and gave a talk at LTC quite a few years ago, and actually told a little bit more in depth about her story than even she does in the video. So it was quite an interesting story, and she gave a lot of insight into what it was like to experience domestic violence. One thing that she talked about was in the very beginning, how it started out seemingly like it was like he was a very supportive person and the things he was doing were so nice. And the three things that she had as a single woman, she had a job, a car, and a credit card. Now, it wasn't a very good car. Apparently, the car was, a beater. It was falling apart. And so when they got married, kind of little by little, he basically chipped away at her independence, but it sounded like he was being nice and supportive. So he'd look at her beat up car and say, let's get you a new car. I'm going to buy you a new car. So he did. He bought her a new car, but he put it in his name. So now technically she doesn't have a car. Next thing was she had a job, and he said, just quit your job. Have children. You can stay home with the kids. You don't need to work. I'll work, and I'll take care of everything. You don't have to work. Oh, that's wonderful. How supportive she thought that was. So now she doesn't have a car, and she doesn't have a job. The last thing then was her credit card. Oh, I'll pay the bills. You don't need to worry about that. You take care of other things, the kids, the house, the dinners, whatever. I'll take care of the bills. You don't have to do that. Great. So now all of a sudden she doesn't have, again, a car, a job, or a credit card. So he pretty much stripped her of all of the things that would make her an independent person, and she has nothing. So, but under the guise of being nice and being supportive and being helpful. So that was the part that she really stressed in her talk. And also the part she stressed was that when we are working with people that are in these types of situations, we can't tell them what to do. We can't say, you're in an abusive relationship, you've got to leave this relationship. That person truly has to come to it themselves. And it's really unfortunate in her situation, how she basically, she did end up coming to the point where she left the relationship, but then, well, you can listen to the video, and she talks about, what happened and how she was basically left for dead, which of course is an extreme situation, but it does happen. But anyways, the point is that nobody can tell you to leave a relationship. It is truly something that that person has to come to themselves. Her family tried. They really tried to discourage her in that relationship. They could kind of see it coming, and she came from a very nice family, but he did not. Her husband did not. His parents were abusive. He was abused as a child, so that's pretty much what he knew. And her family could see it coming, but she just really couldn't until things really got really bad. Her dad, even when he was getting ready to walk her down the aisle when she was marrying this guy, turned to her and said, in the back of church, and said, we could just run out this back door. You don't have to go through with this. And she did. She went through with it, but she kind of remembered her dad saying that. But anyways, when we work with patients that are going through domestic violence issues, many times I'll suggest to the student to have the patient write out a list of pros and cons, because this way, if the patient can list what are the good parts of this relationship, and then list what are the bad parts of this relationship. Sometimes seeing it in black and white can really help a person to make a decision on their own, because we truly can't tell a person to leave a relationship. That is something they have to come to themselves, and that is something that Terry really stressed when she gave her talk at LTC. So anyways, I'm staying on the same slide here for a while, but it's really kind of again, just a really, really interesting graphic representation of just how much this issue just permeates the entire home. So we have to think about the epidemiology and comorbidity. So the prevalence, half of all Americans have experienced violence in their families. And actually that number might even be higher because of cultural or religious influences, or perhaps just the way the family is. If the family is a very quiet family and they don't like to share anything with other people, perhaps there are incidences of violence that are going unreported. So the number actually might be higher. Some people don't report because of shame, because of possible stigma, because they're afraid that they're going to get blamed. Or, of course, one of the biggest fears is when a person decides to leave a relationship. They are really afraid for their lives, or sometimes they're also afraid for their children's lives, and that may keep them quiet and keep them not from talking about what's going on. So I am sure that there are many situations that are just simply unreported. The book actually also talks about the fact that many times children are not even able to verbalize what went on. They can't even talk about it. They're unable to describe their experiences. So perhaps those are also situations that are going unreported. There is also a table, table 28.1, little purple table at the bottom of page 522, that looks at victims of abuse and fatalities among different ethnicities, at least for the year 2014. So that is also something interesting to look at in terms of cultural factors that we would have to think about. Comorbidities. So if you have one type of abuse, it's a fairly strong predictor of the occurrence of another type. And we always have to look at the secondary effects of violence, which are also, we would also consider comorbidities: anxiety, depression, suicidal ideation, and certainly post-traumatic stress disorder, and even personality disorders. So if you remember when we were talking especially about borderline personality and also dissociative personality, when people have especially terrible child abuse and chronic child abuse for many, many years, and sometimes just horrific abuse, they may develop a personality disorder. So types of abuse: physical, sexual, emotional, neglect, and economic abuse. So physical abuse, of course, is understood, and sexual abuse also. By saying that, what I mean is that those things probably don't need a whole lot more definition. Emotional abuse, absolutely. When people are called names, they're degraded, they're told that they're worthless, that they were a mistake, that they shouldn't have been born. Lots of different ways that you can emotionally abuse somebody. And unfortunately, with emotional abuse, there truly isn't any type of reporting form that is specific for that. The scars are emotional, the scars are not physical. As in physical and sexual abuse, it's much easier to determine if those types of abuse are taking place. But emotional abuse really has emotional characteristics, obviously, and ramifications. And neglect, of course, is that the person's needs are not being met. People that experience neglect, whether they're children or older adults, they appear dirty, undernourished, poorly clothed. So sometimes even when thinking about children again, when children are going to school, there are times when maybe their clothes perhaps are really quite dirty. It's obvious that they haven't been laundered, or perhaps their clothes don't even fit, or shoes don't fit, and they're trying to go to school, and they're not fed, they're starving. So their basic human needs are simply not being met. Economic abuse could take the form of failure to provide for the needs of the victim when adequate funds are available. Bills could be left unpaid, possibly even the heat or electricity could be turned off in extreme conditions. And again, as in the example of Terry Jandusa Nikolai, the perpetrator may prevent the victim from pursuing education, finding a job, and trying to be a little bit more independent. So again, basically he took away her car, her job, and her credit card. So that would certainly be a form of economic abuse. The other thing that she told us in her talk that she doesn't say in the video, I don't believe, or at least not as clearly, is that her husband gave her an allowance. I think it was like $10 a week or something like ridiculous like that. And she had to give him a receipt for everything she bought, and it had to add up to $10. So if she was short even 5 cents, then she would get a beating. So that is certainly a form of economic abuse. Another example that we had some years ago was a patient on 1K who was talking about, on discharge, she was talking about how she was feeling so much better in the hospital, and that she really felt like she could stay away from illicit drugs if she could stay on her medication. And of course, then we were asking about, well, why aren't you staying on why can't you stay on your medication when you leave here? And she pretty much says, well, I can't afford it. My husband, I don't have the money for that. My husband doesn't give me the money for that. Come to find out, her husband had quite a bit of money, and so lack of money was not an issue, but he basically was giving her a very, very meager allowance, and so she felt like she could not afford her medication, because with her very small allowance per week, $5 a week, whatever it was, she had to buy her own, her basic care items and food and things like that, and there was no way that she could live on just that small amount of money and take her medications at the same time. So that is another form of economic abuse. So in your book, on page 526, there's a box 28.3 that's common, presenting problems of victims of abuse. So again, just kind of going back to the physical abuse. talking about different things like bleeding injuries, internal injuries, back injuries, broken jaws, different types of bones, cigarette burns. So all, again, physical abuse really covers a lot of different types of things. And then, of course, sexual abuse. And sexual abuse is much more common in children. And things to look for in your book, they're talking about on page 526 again, and top of 527, is that sometimes if children have been sexually abused, then sometimes they're almost preoccupied, they're excessively preoccupied about sex, and sexual promiscuity is actually a problem that could develop as they become a little bit older. They can have PTSD symptoms, nightmares, somatic complaints, and any age adult, whether it's a just a normal regular adult versus an older adult, or a child who experiences abuse, certainly they all can experience different types of PTSD type symptoms, and definitely somatic complaints. So bodily complaints, headaches, backaches, just stomach aches, GI distress, nausea, vomiting, diarrhea, any of those types of issues. Sometimes that's the first thing that brings somebody into care. They're talking about those bodily symptoms, but actually if we dig a little bit further and try to really talk to them about what's going on, sometimes we discover that they're actually victims of abuse. And of course, it's very common now, anytime you go to any type of a doctor or clinic, inpatient, outpatient, we're always asked those types of questions. So as a nurse, you're asking people if they feel safe at home, if there's anybody that makes them feel unsafe. Just really trying to get at the scope of the problem. Sometimes people won't necessarily go to the doctor and sit there and say, well, I'm being abused, but if you ask them, they may volunteer that information. So on the bottom of page 527, there's a purple table called Myths versus Facts about abuse. So probably would be helpful to kind of read through that, because there definitely are a lot of myths out there. So such as the victim's behavior causes the violence. So, and the fact is the victim's behavior is not the cause of the violence. Violence is the abuser's pattern of behavior, and there's other ones too. I can kind of let you go through and read those yourself. So the occurrence of violence requires a perpetrator, a vulnerable person, and a crisis situation. So characteristics of perpetrators. Usually they consider their own needs more important than the needs of others. So more important than the needs of their children or their partner. Poor social skills, extreme pathological jealousy. They may control the family finances. So they may have a lot of control issues, not only controlling the family finances, but again, the other example that Terry Gendusa Nicolai brought up was that her husband really controlled who she could spend time with, and it became very apparent that he was not allowing her to spend time with anybody except for him. He was even jealous of her spending time with their children, but she really was very much forced into a situation where she could not spend time with friends and her own family. So control is certainly a big part of the issue. As for the extreme jealousy, many times that is also linked with control, but it's also a symptom that is linked with potential violence against that woman, and even possible death when there is that extreme jealousy aspect. So the risk factors: men who abuse may believe in male dominance and that need to be in charge. Physically acting out makes them feel in control, more masculine and powerful. Some influences, such as media or family peer experiences, support that same type of message. So I wonder, I'm going to stop here for a second. So I wonder if you can think of any influences in the media or family peer experiences or let's say professional sports experiences that support that same type of message where men need to be in control and in charge, and that acting out makes them more masculine and powerful. So, um, one example I can think of in the media that happened a few years ago was the Brock Turner case. And he was the student athlete from Stanford University who received a very light sentence for sexual assault of a female that was who was basically unconscious. It's really interesting to to look that up. Brock Turner is the name again, and if you care to look that up, but it's or you maybe remember hearing about that. It was a few years ago, but part of the issue was that he was a student athlete, and he apparently was a very good swimmer, and of course Stanford University is a very prestigious university, and it's thought that by many people that he received a very light sentence because of the fact that he was a student athlete. And sometimes that really, if that's true, then that really does put that into a little bit of a different perspective, in that what do we value in the United States, and are we valuing somebody's athletic ability and physical prowess over their their behavior that might even be illegal. And of course, rape is very illegal. It's huge as far as a violent crime, and we're going to talk about that more in chapter 29. But just I thought I'd just bring that up as kind of a, sometimes the way the media portrays things. Of course, there's always more to situations than sometimes we know about just hearing whatever from the media. But just wanted to bring that up as kind of an example of sometimes that if that type of attitude is prevalent, that people that are athletic are able to get out of different types of, being responsible for different types of behaviors that are illegal, especially abusive behaviors, then that certainly has an influence on all of us in society. So there's, I'm sure, many other instances that you can think of also where there are famous people, and especially people in different types of sports teams that have had problems with sexual assault of females, and perhaps they're not always given that the sentence that somebody else would be given that didn't have that fame or fortune, or again that physical prowess. So just something to kind of think about. So the other risk factors that we want to look at would be that, again, that pathological jealousy and restriction of mobility, controlling the finances, use of substances. So many times when people that are abusive, and I'm probably saying male versus female more than likely, mostly because that is the typical perpetrator is certainly a male, but females also can be perpetrators. So we have to think of both ways, but it is more likely for a female to be a victim than it would be, or a survivor, than it would be a male. But certainly males are also at risk. But anyways, so using substances makes the person, whoever is the perpetrator, makes that person more likely to perhaps to act on their impulses, just because of lowering those inhibitions. And we also have to think about pregnancy in the female partner certainly may trigger violence for many different types of reasons. So perhaps the child was not really wanted. Perhaps the pregnancy is not going very well, and the female who is pregnant is not feeling very well, or as with most pregnant women, you kind of get a little bit self-absorbed, and you're worried more and you think more about yourself and your child than you do about everybody else around you, including your partner sometimes. So there is that aspect of jealousy in which the male in that relationship may feel like they're not number one anymore, that that child is more important than they are. And then, of course, after the child is born, that certainly also puts that child at risk. So, characteristics of vulnerable persons, women. So, again, pregnancy can trigger or increase violence. Violence may escalate when a wife makes a move towards independence, and the greatest risk for violence is when the woman attempts to leave the relationship. So, if we think to ourselves, well, why doesn't this person just leave this relationship? It's really not very easy, and it's something that we have to watch ourselves, because it's easy to be judgmental and just think, well, why can't they just leave the relationship? It's not helpful at all. It's not healthy. Why can't they just walk away? And truly, a lot of it is out of fear. So the woman is afraid that when they leave the relationship, that something truly terrible is going to happen. And many times they actually do get clear verbal threats. You leave the relationship, I'm going to kill you. So it can be just very, very blatant like that. So that's a big fear that people have when they are in that vulnerable position. So, characteristics of vulnerable persons, children. Usually, children younger than 4 years old are more vulnerable than older children, mostly because they can't really speak up for themselves. They lack, cognitive abilities to be able to describe incidences, and they also have just overall less ability to follow directions and to problem solve like older children do. So they can be very frustrating when they're younger than 3, 4 years old. You can't tell them to go clean your room because they simply can't. So we do have to think about sometimes what makes a child truly vulnerable is that they are, whether it's a male or a female child, sometimes people have expectations that are for the child that are greater than their developmental level. So again, I've heard of stories where a 2-year-old will get a severe beating and be a victim of child abuse because they didn't go and clean their room. Well, a 2-year-old can't go and clean their room. So having those expectations that exceed their developmental level certainly is going to put somebody at risk. And of course, well, you might be thinking, well, it's if truly somebody had that high of a expectation of a developmental level of a child of 2, then they're simply uneducated. They truly don't know child development. And that probably is partly correct. So there are people that truly don't understand child development. Um, so many people get very frustrated with babies, and so we have shaken baby syndrome that happens because they're usually trying to make the baby stop crying, and they get very frustrated and try to tell the baby to stop crying or make the baby stop crying. And of course, babies don't just stop crying very easily. They have a need that needs to be met before they can stop crying. So that young age really puts a child at a great deal of vulnerability. The child might be perceived as different. A child might be perceived as different because of perhaps just their personality and their temperamental traits. Perhaps if they have something wrong with them, such as a congenital abnormality, or maybe if they have a chronic disease. So somehow they're perceived as being different. They also may remind the parents of somebody that they don't like, maybe a former spouse or an ex-girlfriend. So the child might be the product of an unwanted pregnancy. There may be some interference with emotional bonding between parent and child. So when a child is born prematurely and they are in the neonatal intensive care unit, then sometimes there isn't that opportunity for parents to bond initially with that child. The other issue with bonding is that sometimes children are at high risk to be abused by an unrelated caregiver. So, in other words, like the mom of the baby or the young child, um, is going off to work, and her boyfriend, who is not the father of the child, is left to babysit the child. So, not that that's always going to be the case, that it's going to be a bad situation, but if you look at statistics, that many times is the situation. So that bonding hasn't really occurred then because it is not that person's child. And girls are slightly more likely to be abused than boys are. Adolescents are also abused almost as much as younger children. However, in your book, it talks about that this abuse is sometimes overlooked because society views adolescents as capable of defending themselves, whereas a child younger than 4 years old, we don't feel is capable, and of course is not developmentally capable of defending themselves. On the bottom of page 522, there is a green table that is called Characteristics of Abusive Parents. And so it goes through being authoritarianism, low self-esteem, poor coping, again, having that history of abuse, neglect as a child themselves, history of mental illnesses, history of violent temper outbursts, poor impulse control. There's more than that, but I'm not going to read them all for you, but I'll just refer you to that box 28 dash or dot one, characteristics of abusive parents. So child abuse, the most common types: neglect, about 78%, physical abuse, 18%, sexual, 9%, and emotional and threatened abuse, lack of supervision, or parental substance abuse is about 11%. Now, I added all those up. That adds up to more than 100%, but those are the statistics that your book gives. I'm guessing because some of these areas overlap a little bit, and certainly it is possible to have more than one type of abuse going on at a time. But certainly neglect is the most common type of abuse. So the other thing to think about that this cartoon kind of clearly indicates is that if mom and dad are having difficulties, or mom and boyfriend, whoever are the main caregivers or adults in the home, if they're having difficulties and they're abusing each other, or one person's being abused, many times the child is caught in the middle. And so that can be a very difficult situation for the child also. And maybe that isn't something that we often think about when we think of family violence and abuse situations. But many times, even if the child isn't being directly abused themselves, witnessing violence in the home is certainly very, very detrimental to the health of that child. So now we're looking at characteristics of vulnerable persons, older adults. So many times when we're looking at older adults, we're noticing that they are having poor mental or physical health, and that makes them a little bit more likely to be abused. So if they're in poor health, they have more needs. There are more things that need to be done for them. They are less independent. So that can be very frustrating for people that are trying to help them or be their caretakers. Book gives you some really sad examples on the bottom, starts at the bottom of page 524 and then goes to the top of page 524, the right-hand part of the column. Ugh, I don't know if I said that right. But anyways, they are giving some examples that they found in the news, where an example is an 87-year-old woman in Missouri died 2 days after being found naked and lying in a bed soaked with urine and fecal matter. Her daughter was charged in the incident. She said she would have taken better care of her, but she was too tired. So there are times that the needs of that person, so if they're in really poor mental or physical health and they really need a lot of care, then there are situations where the people that are trying to take care of them simply don't have the resources. I'm not saying that was an excuse, like a good excuse for letting that happen. However, some people find themselves in situations where they're completely overwhelmed with the duties that are needed to take care of an older person who is in poor health. And again, that poor health mental or physical or both, makes them very much dependent on the perpetrator. So the perpetrator is their main caregiver usually. Being a female and older than 75 years old, white, living with a relative is just for whatever reason statistically significant as a characteristic of a vulnerable older adult. An elderly father cared for by a daughter that he abused as a child. So it's very possible that that daughter now is going to turn around and abuse the dad because that's how she was brought up. Elderly woman cared for by a husband who has abused her in the past. So, and I've actually seen that situation a couple of times on 1K where patients are very worried about being abused or even talk about being abused at home, and that how that happened pretty much throughout most of their marriage. And now that that person is older and more frail, really worried about the abuse picking back up again. So this cartoon, again, just is kind of demonstrating that this poor woman is older. She's got a walker, and she's kind of hunched over a little bit, and there is somebody who is above her and just looks like he is just being very, very verbally abusive towards her. So again, abuse can take many forms when we're talking about older adults. It certainly can be verbal, physical, sexual, the same as any other age group. This is also another interesting cartoon that I found, basically that looks at like social support clues when we're thinking about our older adults. So if that person is isolated, and especially if they're isolated because nobody is taking them anywhere, they're kind of allowed to be isolated because perhaps they're no longer independent. They can't drive anymore, and perhaps they can't even take a bus or ambulate independently. So now they're kept very isolated. Their mail is intercepted. Possibly they're doctor shopping, they're kind of going from doctor to doctor, perhaps because if they stayed with one particular doctor, that a pattern of abuse would become evident. Financial decisions that are being made against the elderly person's interest. So the example in the cartoon is that the son is saying, "Mom, it's nearly ready for your big downsizing," and basically it looks like it's something that she wouldn't even fit into. So it would be definitely against her will to be going into such a tiny little home. So when you see situations like that, those can also be cues that something is going on with that person. And the other thing, this is just again another little cartoon kind of representation of like the house is just that they lived in their whole life is just being squeezed apart by somebody, and you can see the two older people kind of down on the ground, and their cane is flying around, and their belongings and glasses are on the ground, and just so many times people end up in situations where they get scammed out of their belongings, or somebody forces them into situations that they really aren't ready for. I read some articles a few years ago about, I believe it was could have been both actually. Arizona and Florida are states that typically a lot of older people retire to. And there was a scam going on. I think this one was in Arizona, where people would come into an older person's home and basically tell them that their lives were being taken over by, they're called like patient advocates. And these advocates were going to help them, supposedly, to manage their lives better. And basically, the first thing that they did, and I'm not really sure how they did it, but they did get caught and jailed eventually. But they basically told the older people that they had to leave their home and that they had to go into a nursing home. So, and sometimes older people are just really vulnerable to things like that because maybe they don't think to question, or they think, okay, somebody else is in charge and I have to do what this person says. And so I read a very sad story about this couple who actually were managing okay in their own apartment were forced to leave their apartment, forced to go into a nursing home, and then they were medicated because of these advocates kind of took control of their lives. They were medicated against their will with strong psychiatric medications that they actually didn't even need. And they really got them to the point where they just felt completely helpless. And it took a lot of legal action, and I believe then their own children got involved and helped them with the situation. But by that time, the damage was done. They had pretty much sold all of these so-called patient advocates who were scammers, pretty much sold all of their belongings and just pretty much ruined their lives. So much for the golden years. Sometimes older people truly are very, very vulnerable to scam artists, and so we have to really be careful and watch the elderly people in our lives and under our care as nurses. So the crisis situation. So we need the victim, the perpetrator, and the crisis situation. So the crisis situation is any situation that puts stress on a family with a violent member. So that can be so many different things. It can be something as simple as being pregnant for yet another child, or it could be the stress of perhaps somebody losing their job. It could be the stress of changing a job situation. Perhaps it's another family member coming to live with them. It truly could be any situation that causes stress, and that people with effective impulse control, problem solving, and healthy support systems are less likely to resort to violence. So we do have to think about that. Again, think back to the perpetrator and think that the perpetrator does not have good, healthy coping skills, and they truly don't have good support systems either. They're usually very isolated. If they could have good support systems, then perhaps they could elicit help from friends and family members, but they tend to be more isolated. So if people did have those good impulse controls, good problem solving skills, healthy support systems, they're not as likely to resort to that violence. The crisis situation can leave the person incapable of dealing with the situation. It just simply puts them over the top. It's beyond their usual ability to cope. And again, that social isolation contributes to ineffective coping. They don't have anybody to talk over their problems with. They don't have anybody maybe they can even ask for some help like most of the rest of us do. So a little case study situation. A 12-year-old boy, Adam, is admitted to the ED with a broken wrist, swollen eye, and fractured radius. His parents seem very anxious, and the father seems particularly on edge. When you, as the attending nurse, ask, "What happened?" the mother immediately says, "Skateboard accident." Adam looks up at her quickly, and she smiles at him and says anxiously, "Honey, we've told you to be more careful on that thing, right?" She has tears in her eyes and breaks eye contact, raising a shaking hand to her mouth. So I'm hoping as I'm reading through this that you're kind of getting a little suspicious that perhaps it really wasn't a skateboard accident. And sometimes I think that this is pretty much a very typical scenario, that people seem more anxious than usual, on edge, and that they may offer like a quick rationale for whatever happened. Oh, they fell off a chair. Oh, they did this. Something that is just obviously an excuse that they're trying to give instead of saying what really happened. So yeah, we can kind of tell somebody's hiding something here. So the case study goes on. 12-year-old Adam is taken for X-ray imaging of his forearm. The attending physician sends his parents to the waiting room, and although the father in particular is reluctant to leave his son's side, it becomes mildly agitated. You can see him again soon, the physician occurs, but not in radiology. So reluctantly, the father cooperates, You don't have to bug the kid about his skateboarding, okay? Last thing he needs is questions. He never can think straight on a normal day when he's badgered, let alone when he's hurt. He's in a class for mildly retardeds. So again, now I'm hoping that some things are kind of coming out to you and you're thinking, this is kind of again getting a little suspicious, especially when somebody doesn't want to leave someone's side. Now, it's of course normal if your child is hurt, you want to be with your child, but it just seemed like they're not able to, a 12-year-old, they're not able to let him go off to an x-ray image by himself. That's maybe a little bit suspicious. Perhaps if it was a toddler, certainly they would probably let the parents go along. But anyways, so understood, the doctor nods. And just to refer to his son in a derogatory manner, we have to kind of be suspicious about that too. So, alone with you, the physician says quietly, you as the nurse, that dad's a little on the angry side, more tense than worried, I think. See what you can find out while I buy you some time. You agree. So alone with Adam, you say, my little brother falls off his skateboard a lot. What kind of board do you have? Adam looks panicky at the question for a moment, then shrugs and says, I don't know. You try again. Jason has one of those with a ninja painted on it. Do you have that kind? I don't know, Adam says. Maybe? So discussion question. Again, we're kind of suspicious about something else going on here, of course. So what are some questions you should ask Adam? So it certainly is okay to ask Adam and say, how did you hurt yourself? What happened to you? You certainly don't want to say something like, what did your parents do to you? You don't want to make him defensive, and you don't want to put words into his mouth. You really want to be as open-ended as possible and ask him to describe what happened, and also to ask him what happens when you misbehave. How do your parents discipline you? What do they do? And how often does this happen? So you can start out by asking questions about his home life, and those would be very appropriate questions and might be very telling as far as what's really going on in the home. So Adam admits, I don't have a skateboard. I didn't fall off anything else either. He agrees to tell you what happened as long as you keep it a secret. What should you do? So truly, we never should keep a secret. But should we agree to keep the child's secret to build trust, ask the child's parents to explain what happened, report the suspected abuse to Child Care Services, or have the child talk to another victim of child abuse? So I am hoping that you picked C, report the suspected abuse to Child Care Services. So Child Protective definitely should be called, even just with a suspicion. So you can't agree to keep the child's secret to build trust, because in this type of situation, as a mandated reporter, we can't keep that secret. We have to tell. We're mandated to report all incidences of suspected abuse to Child Protective Services. Asking the child's parents to explain what happened, we'll get to that eventually, but sometimes we don't want to make the parents defensive any more so than they already are at first. We kind of have to get their trust a little bit, and having the child talk to another victim of child abuse certainly isn't going to be very helpful at all. It actually could be detrimental. So that certainly would be nothing that would be done at all. Case study discussion. In the end, you do suspect child abuse. What important documentation is needed? So certainly if he has physical injuries, which it sounds like were described in that first slide, a body map and document all of the injuries for sure on a body map. It's also really important to document exact word for word, put it in quotation marks, anything that the child says, and then anything that the parents say. Those should all be in quotation marks. So a lot of documentation as far as the verbal exchanges that are going on, and any information that you can get from the child or from the parents, especially when you're asking the child about how he's disciplined, what happens at home when he's naughty, what do his parents do, and how do they and how often does that happen. So any information that you can get definitely needs to be documented. It's really helpful to document or to interview the child alone, the parents alone, and then watch them interact together. So it can be very interesting just to see how if they do interact differently when they're together than they do when you are interviewing them separately. So definitely we need to document physical signs and symptoms, emotional signs and symptoms, body map, and usually direct quotes as much as possible. So another audience response question, recalling the father's behavior and some common perpetrator and victim characteristics, which might you cite as the most likely indication that the father is possibly a perpetrator? His description of his family's needs, his insistence on being the one to provide financial information, his disdain for skateboards, or his description of his son's learning disability. So I am hoping that you picked D, his description of his son's learning disability, because he truly talks about his son in a very derogatory manner and is basically kind of verbally abusing him at the same time as he's describing him. So he's really putting him down. And so that would give you a hint that if he's verbally putting him down and frustrated with his son, that perhaps that abuse is also physical. So, alone for a moment with Adam's parents, which secondary question is least appropriate to ask at this time? How do you discipline Adam? Who helps you take care of his special needs? What about Adam's behavior bothers you the most? Or what did you do to this child? So I'm hoping you pick D as the least appropriate. So we really wouldn't want to ask it that way. We might want to say what happened, but we don't want to say what did you do to this child, because that would really put them on the defensive. Perhaps they're even going to walk out and leave the emergency room, and it would be difficult to, get any more information out of them. So we want to keep them there, and we don't want to put them on the defensive. Discussion question. Remembering his situation, you decide you want to help prevent child abuse in the community and plan to hold classes for new parents. What are some topics that should be covered? Maybe you can think of some others too, but we can at least start out with, again, what I said about knowing what is appropriate developmental behavior for that child. What to expect at different stages of development would be very important. That would help somebody to understand that you can't ask a 2-year-old to go and clean their room. That just developmentally, they're just not capable of that. So having that type of knowledge could be very helpful. Positive ways to interact and to discipline their child would be another great topic. Using support systems is another wonderful topic, and even information on developing the parents' own individual coping abilities. And certainly refraining from drugs and alcohol would be something very helpful in helping them to cope a little bit better. So those are just a few topics that I can think of offhand, and perhaps you can even think of a couple more that would be also very pertinent. The cycle of violence. So now we're thinking about that whole cycle of violence, the tension building, the acute battering, and the honeymoon stage. So this is more related to, it could be related to child or elder abuse, but mostly we think about this as the intimate partner violence. So, and you probably had a little bit of this in health promotion. Actually, kind of like this. I found this slide. I like this a little bit better because it kind of breaks it down and describes it a little bit more. But honestly, the reconciliation phase kind of goes along with the honeymoon phase. But so the tension building phase, tensions are increasing. There's a breakdown of communication. The victim becomes fearful and feels the need to placate the abuser. So many times the person who's being abused is walking on eggshells. They don't want to upset the abuser. They're maybe trying really hard to keep everything under control and to keep everything good so that that person doesn't lose control of their behavior. But sometimes that doesn't always work, and you have the violent behavior happening. There's an incident, and then there's verbal, emotional, and physical abuse, anger, blaming, arguing, threats, intimidation, and again, the actual abuse occurs. And then after the abuse happens, the abuser apologizes, gives excuses, blames the victim possibly, denies that the abuse occurred, or says that it wasn't as bad as the victim claims. And then that leads into the calm or the honeymoon phase where the incident is forgotten. There's no abuse taking place right now, and they're kind of in a honeymoon phase. And sometimes that is the most difficult phase for the person to leave, who is being abused, to leave the relationship because they want to believe those apologies and promises. Sometimes the abuser even gives gifts to the person they're abusing because they're trying to win them back. They're trying to make up for, almost as an, if you think about back to those defense mechanisms, undoing. So by giving gifts and making promises to love that person and never to do it again, they're undoing their bad behavior, or at least trying to. And so the person who is being abused just really wants the relationship to flourish, and they want the abuse to end, so they tend to believe those promises, and they usually end up staying in the relationship unless the way that the person would be able to get out, to break this cycle of abuse. Certainly the person needs some counseling. So it's very difficult because without any type of intervention and counseling, the cycle is just basically going to keep continuing. So, and this is just another little cartoon representation of different types of abuse. So we may not think of all of this as abuse, but any attempt to discredit somebody, intimidate, humiliate, disrespect them in any way, or threaten, all would be considered abuse. It's not just beating or any type of other physical abuse. Certainly emotional, mental abuse is very, very prevalent. But again, there isn't any specific, I don't know, I've talked to a couple of police officers about this, unless things have changed recently, but there truly is no specific form to fill out saying that you are verbally abused, but it certainly still is a problem. Application of the nursing process, as always, we're looking at making assessments. So we're doing general assessments and thinking about the whole interview process and the setting, and we're always doing that self-assessment. So for the assessment, again, that general assessment, you're really looking at the overall picture of the person, especially thinking about that we will be encountering victims of violence in just about every healthcare setting possible. So all patients really should be screened for possible abuse. And also really to think about the fact that when people have vague somatic complaints, again, that many times that is a way to almost to express what really is going on that they can't verbally talk about. So it really does help to try to whatever you can do whatever you can do to make that person feel comfortable and to trust you enough to open up and share more information. So we certainly always should be asking questions about if is there possibility of sexual abuse, family violence, and drug use. So definitely most places have policies and procedures for really needing to screen and ask about those different types of situations. So certainly a good, thorough physical and psychosocial assessment is very helpful. The interview process and the setting, again, really kind of leading into things. We don't want to bowl somebody over and say, you've been abused. Who's abusing you? What did you do to deserve this? Or even just something that, of course, would be pretty darned inappropriate, but also just to say something like, come on, tell me you're being abused, right? I mean, we can't be putting those words into somebody's mouth either, and we can't be demanding that information because that person may not be ready to talk about it, or they may just be really scared to talk about it. So we have to be very tactful, very professional, and there's actually a very nice table called Interviewing Guidelines in green at the bottom of page 525 that really talks about how the interview should be private, we should be direct, honest, professional, use language the patient understands, ask them to clarify, be understanding, be attentive. We certainly don't want to ever, and there's a nice little part of there, do not try to prove the abuse by accusations or demands, display horror, anger, shock, or disapproval of the perpetrator or the situation, place blame, make judgments, all those types of things would be really very unprofessional. So it is important to really be talking to that person in a very private, quiet setting, and not to have the door open, not to have people kind of bopping in and out of the room. So those are all things that are really quite important to trying to gain the trust of that person. Another thing that's important is that we really should be giving them plenty of time to tell their story as they're able to. We've talked about self-assessment pretty much as we've gone through every single learning plan, I think, so far, and we'll probably continue to. But anyways, we always have to really think about the difficult types of feelings that this can elicit, this type of situation can elicit in you as the caregiver. It may arouse really intense or overwhelming feelings. We might have very strong negative feelings towards the abuser. We may actually be very angry even at the person who's abused and may think something like, why can't they just leave? Why do they stay in this relationship? We may be angry and even blaming towards the victim, or survivor. So we really do have to watch that we hold our own personal feelings in check and that we don't allow those to cloud our professional judgment. If we have, your book talks about on page 529 that if we have a personal history of abuse, that might even cause us to identify more closely with a victim. And then again, you're going to be having, clouded judgment. So it really is very important, if we do have personal issues, that we talk about those with, usually with another professional person in order to make sure that you're not going to be having that clouded judgment and not be able to interact and help that person in the most professional way possible. I think I'm going to end this recording and start another one tomorrow morning.